Hi guys, Toby here with the Physio Studio, the second video in our series talking about sciatica, where we're going to be going in a little more detail of how to assess your pain to decide whether it's a sciatica or whether it may be something else. So as we've discussed in part 1 of this video, to be a sciatica it must be pain along the back side of your leg with or without the presence of back pain. So if it's purely in the back, purely in the front or side of your leg, then it's most likely not a sciatica. The other symptoms we discussed can be weaknesses in certain muscles of the leg, especially straightening the knee or coming up onto our toes. But it's important to note that if we have these weaknesses or these numbnesses on both legs, on both sides, if we're having numbness around your groin or tailbone area, or if you're having difficulties going to the toilet, either with your bowel or bladder, then this may be a medical emergency and is something you definitely need to get checked out ASAP rather than delaying. If you're not experiencing these symptoms, we're going to go through a few tests there today to assess your pain a little further. So the first test we're going to do with a sciatica is we're going to put a pull onto that sciatic nerve to see, does it reproduce our pain? So the simplest way we'll get people to do this is just standing up. We'll ask them to bend down, trying to touch their toes. Now if you just feel tightness in both legs here, or just the pain in your back, this is a normal result, or at least it's not telling us there's a sciatica. If, when you bend forwards, you feel much tighter on one side, or you feel pains shooting up into the hip or into your back, that's more an indication the nerve may be irritated. The second check we'll do here, and it's important to do this on your good side first to see what the normal leg should feel like, so you'll know the difference if you do have a positive result on the other side, is going to be what we call a straight leg raise. So for this, we're going to lay onto our backs, we're going to use our arms and try to lift one leg, keeping the knee straight as high up as we can. First we'll do this with the leg relaxed, and if we're feeling pulling just into our hamstring, that's a completely normal result, it's not telling us anything much. If in fact you're feeling pulling into your calf or into your buttock or back, that would be an indication that the nerve is already tense. And the way we can assess for this further is keeping our leg high, we're going to pull our toes down towards ourselves like this. If this really provokes either that calf, thigh, buttock or back pain, that's definitely an indicator that we're dealing with a sciatica. Now again, it is an uncomfortable sensation even in a normal nerve because we are taking that nerve and just stretching both ends. So it's important to do this on your good side first, to compare and contrast with the other side. Now something that can give us a false positive here, or look like a sciatica but not be actually, is what we call piriformis syndrome. So this is what happens when piriformis, one of the small muscles in your buttock, can pinch onto the nerve where it passes underneath that muscle. Now as we've discussed, this is different to a true sciatica, which is where the roots of the nerves, the roots in your back, get irritated, as this is where the muscle is pressing directly onto that nerve itself. It will often give you a positive on this straight leg raise test, but it will differ in certain other ways. So with the piriformis syndrome, your pain will be worse when you're sitting down, it'll be much more isolated to the buttocks, and it can often be changed by doing things like stretching out your buttock muscles, so sitting in that figure 4 stretch, and stretching out the glutes will ease your pain if it's purely a piriformis. Whereas with sciatica, that may not always be effective. So we've talked a little bit about the tests there today. The final video will be talking a little bit about treatment.